The first question I'm going to start off with is, when is the right time to go to the gynecologist for the first time? And to answer that, I'm going to tell you a couple of things. If you're sexually active, you should see your gynecologist either before you become sexually active or regularly after you're sexually active. If you have period issues, you should definitely see your gynecologist. If you have any issues with, lumps in your breast, a lot of breast pain, a lot of really weird pain on your, very, very bad pain on your period, pain that stops you from doing regular life things, If that's happening, you should definitely see your gynecologist. Basically what I'm saying, if you have a complaint, you should see your gynecologist.
Do I smell funny down there? How is my vagina supposed to smell? I've said this before, I'm saying it again. You're not supposed to smell like roses. Nobody does. Vagina की एक unique, एक pungent smell होती है जो बहुत normal होती है. But yes, if you've been experiencing excessively fishy odor या फिर change in the kind of discharge, itching, then it's a problem. But otherwise, depending on the time of your menstrual cycle, you will smell differently and that is normal.
What is a pap smear and why do I need it? So a pap smear is basically an internal examination where they will look at something called your cervix. Now your uterus, this is the part where the baby stays, has a little corridor at the end. And this corridor has its doors shut all the time. This corridor is called the cervix and it sort of protects the uterus and keeps the door shut. Every once in a while, which is to say that once you're sexually active every 3 years, while you're in your reproductive age, you should get a cervical exam in which they can take cells from your cervix and see if there's anything abnormal happening here.
Why do I get like a weird urine-like smell all the time from my panty? That might be because you're using synthetic panties, and using synthetic panties is not a good idea for everyday use. So kabhi the days you want to feel special, you want to feel romantic, wear your fancy lacy panties, but for a day-to-day thing, wear a normal cotton panty which is breathable, which lets the good bacteria grow, which does not cause fungal infection, does not cause the funny smells, and helps you prevent yourself from vaginal or vulval infections.
Other question we get very often, this is a very common question and you will see lots of YouTube videos about it that are full of absolute crap, is that my inner thighs or my vulva is darker than the rest of my skin. What do I do about it? How do I cure it? And let me tell you, this is perfectly 100% normal. Brown people like us in particular, have darker inner thighs, have pigmentation on the inner thighs, have pigmentation on the vulva. This is a result of hormonal changes in our body and this is not abnormal. Unless of course there has been a sudden change in the color of your skin, if it's been brownish before and suddenly become black overnight, or if it's raw or painful to touch or anything of that sort, then you need to see a doctor. But inner thigh pigmentation is not abnormal.
I'm sexually active. Can I still get the HPV vaccine put, which is the vaccine that protects you from cervical cancer? Yes. Till 45 years of age, whether or not you're sexually active, you should get the vaccine put. 14 years ke pehle lagaoge, so it's the best. You only need 2 doses. But even if you're getting it put after 15 to 45, you need to get 3 doses put and you must get it done.
I'm going to address sort of the last question that we tend to get a lot, how their vulva looks, which is that a lot of people are concerned that, I have very long lips, which means not these lips, the lips downstairs. They don't look as symmetrical or as perfect as they do in pornography or wherever else you've seen them. And that's also normal. A lot of people have long lips. A lot of people have one long lip and one, say, shorter lip. A lot of people have lips that don't protrude outside at all. This is fine. We come in a huge variety of shapes and sizes. There is no right or wrong. Don't feel shame around this. Don't try to go get surgery for this, unless of course that empowers you in some way, but it's not something you should feel shame around.
Subscribe to the YouTube channel and don't forget to hit the bell icon so that you don't miss any videos by us.